Rural medicine fosters innovation in a number of ways. You have to be innovative if you're going to continue to provide high-quality patient care.
And if you think of how our farmers and ranchers have innovated through the years, we continue to follow in their footsteps. Because sometimes when you do have limited resources, you have to think creatively and think progressively in order to deliver care.
And so thinking through how do you provide a service, a healthcare service, to people who are so dedicated to their jobs, to their vocations, that essentially requires them to be on that land 24/7. That's what it means to think through supporting rural America and rural health. One of the ways that you can be more effective in the services that you give is by collecting them, by co-locating, by building huge opportunities of service. And by its very nature, rural means spread out. It means that you can't do that.
Especially in areas of the upper Midwest where we have really disproportionate supplies of physicians relative to the population or the geographic area, I think telemedicine is perfectly suited for those situations, really because we can provide very high quality care where really that care might not be available at all to people living in those areas.
When a subspecialist is involved, that is what they do all day, every day. That's all they do. So they're very comfortable in this one specific area. A rural doctor can't be comfortable in every area. It's impossible. So what we can do is bring that comfort and stability and evidence to rural areas through telemedicine.
It went really fast when it happened. I just started feeling a little run down, a little tired. It wasn't like the flu, it was much worse. And I started to ache from head to toe and shake and almost convulse. I could not physically get up off the bathroom floor, and I had a temp of 104.
So she was admitted through the emergency department because of fevers and headaches. We were asked to see her because of the severity of her abdominal pain and the elevated liver functions.
Immediate concern, so I must have looked like I felt.
Our mission, if you will, was to prove that it wasn't a bad gallbladder or wasn't an infection of the liver that needed to be treated. Then it came down to, well, if it isn't a bad gallbladder, what is it? And that's when the infectious disease specialist got involved.
Care in infectious disease is really lopsided across the U.S. And so virtual care and telemedicine really allow us to expand our reach. So the nurse on the other end is sort of our hands. We can see and we can hear everything that's being done through those peripherals.
It's just like having the physician in the room, and the nurse is in there and she does the vitals, but they can hear it. They looked in my eyes in the room, but the physician on the other end could see in my eyes. It's just amazing, the technology. It was just like having the person sitting there in the room with you, and you felt the same amount of care and attention even though it was on a screen. Behind the scenes, the infectious disease team consulted with each other. It's very rare what they were discovering, so they were trying to figure it out as a group to get back to me.
Rocky Mountain Spotted Fever is an infection you can get from the bite of a tick. It's not very common, and that can sometimes make the diagnosis difficult. So it can be a life-threatening infection. The challenge with it is that there's only a small window of opportunity where it has to be treated.
Wow, experiencing something like that, it was life-changing. I mean, they literally saved my life by using that communication as a medical team.
I think of virtual care as just another tool in all of the tools that we have to deliver care to our patients, right? Virtual care is never going to replace the doctors and the nurses, in our hospitals. We have a shortage of nurses and physicians projected in our future, and we need to find a way to utilize the staff that we have and the new staff that we get in the most efficient way, and virtual tools allow us to do that. It gives us more options into how we use our care. Virtual nursing is a service that we offer that allows remote nurses to help support the bedside nurse and the care that we're delivering to the patient.
So virtual nursing augments that on-floor nursing with capability to assist. When we give narcotic pain medications or blood transfusions, it requires 2 nurses to be able to do it. Well, with virtual nursing, then they're available to do that off-site assistance, but provide that same level of care and same level of security and safety when we do those sorts of things.
We're able to keep patients safe without having to increase your workforce, really, right? And so the nursing standpoint, it'll just be another nurse with expertise. A lot of times these nurses are in their rural facility by themselves at night.
They would now have the ability to call on this bank of virtual nurses who may have nurses with expertise in OB or pediatrics or oncology that they might not have in their facility.
Now this technology, this connectivity allows me to continue with all the wonderful things about living in rural America, but still having access to the specialized medical care that's present in cities.
Avera is the right place to be leading this charge with virtual care. When I look at our footprint and our geographic area, we really have the opportunity to keep patients close to home for the care that they need, giving them the care at the right time, at the right place.
Avera was at the cutting edge of telemedicine and virtual visits. We use telemedicine in different ways. Sometimes it's for an emergency. Sometimes it's inpatients in our facility that we need help sometimes, and we need that specialty help.
Not only do they provide support and expertise, they can also save a lot of time and drive efficiencies of care. And I think for a rural provider, what's really important is they can have the reassurance to know that they did everything they could do to help their patients.
I really appreciate how willing Avera is to be innovative and to challenge us to find new ways to work and new ways to deliver high quality care to patients. And that makes me really proud to work at Avera. It makes me really proud to be a part of this virtual care project, and it makes me really proud of the care we give to our patients.
The depth and breadth of the capabilities of the staff that we have and their absolute dedication to our mission is an incredible thing to see. So I couldn't be more proud of each individual in Avera and the collective team of Avera and what we have been able to do, and equally important, what we will be doing.